The environment. The environment is important because, it's really where, you hit the road in terms of activities. And whether you're playing on mud or turf or grass appears to be a factor. Recent studies that have not been published as of yet are very concerning for the use of the artificial turfs. We started off with grass years ago. We went to artificial turfs. We left the artificial turfs, went back to grass, and now the movement is again to the synthetics. Unfortunately, the most recent data coming out of the National Football League shows that the severe injury rate on those surfaces is probably about 100% higher. In terms of surgical treatment, our tools have improved, and this has been the best part about being in orthopedic surgery, and especially sports medicine in the last 20 years, because arthroscopy, the ability to put a tiny scope into the knee and not have to open up the knee with a large incision, has been a great advancement to avoiding a lot of the problems that we saw with previous procedures. So ligament reconstruction now, commonly done through the arthroscope. In the past, we used to take menisci out, lickety-split. In fact, many surgeons bragged about how quickly they could take them out. Now we do everything to keep them. We do everything we can to repair them and not remove them, because we know what happens when you take out the shock absorber, the meniscus. It's a very good study done out of the University of Iowa that shows if you have an isolated meniscectomy, only a meniscus taken out of your knee, nothing else wrong, over the next 20 years, your risk of osteoarthritis increases 1,000%. So in kids especially, that's very important. Always, 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 our first thought with meniscal injuries now is to try to repair them. And we do have tools now to even resurface some of the articular cartilage problems that Ryan also mentioned. So how about non-operative treatment? Well, even though we're surgeons, we do focus on non-operative treatment whenever possible. But that has to incorporate things like controlling forces across the knee joint, protecting injured structures. Many times this is done with braces. Strengthening muscles, which we really utilize a lot. Probably the largest component of practitioners that we have at MedSport, for instance, is our athletic trainers and physical therapists. And there's good reason why, because those people can help most problems. And then because weight is such an important factor across the knee joint, weight control always enters into it. Well, how about medical treatment? A lot of anti-inflammatory medications on the market. Some of them are really good. And as you know, some of them were recently taken off the market. They were the best ones. But you have to be careful because of that. Because the stronger the medication and the more effective it is, many times it has effects elsewhere in your kidney and your liver and things that you may not know for the first couple of years of its use. So we go slow with those. How about viscosupplementation, the addition of lubricants into the knee joint now, especially in the cases of osteoarthritis? That's been a really big improvement for us. The unfortunate thing is it doesn't help everybody with arthritis, but the people that it does help frequently can get months of relief. And we're not changing the underlying condition. We don't do anything surgically. We're simply adding really an oil change. That's what viscosupplementation is. It's the natural oils that you would find in the knee joint that in osteoarthritis, those are not produced at the same rate. Chondroitin sulfate and glucosamine are two of the most widely used medications for knee problems in the world. And we do have a lot of patients who swear by them and are very happy with those medications. Unfortunately, if you take the scientific literature that describes their use and outcomes, it may not be better than sugar pills. Now, the good news is it doesn't hurt anybody. These are medications that, as far as we know, about the worst thing it does is it costs you when you go to the store. But we don't think that it will hurt you in terms of any of your physiology. The disappointing part is that we can't prove yet that they're the way to go. Cortisone, no doubt one of the most effective treatments that we have. Unfortunately, it's not something that you can use every week, and it does have some possible side effects that we need to be very careful of. But then again, used in the proper circumstances, it's probably one of the most potent, best medications that we have.